My name's Ron Waldman, and I'm a professor of global health at the George Washington University in Washington, D.C. I'm also an emergency health advisor to Save the Children, and I am leading the Save the Children team from the U.S. in dealing with their response to the Ebola outbreak in West Africa. So there have been a little bit more than 20 previous outbreaks of Ebola virus disease. All of them have been in Central Africa, and all of them were contained. The current outbreak in West Africa started in the forests of Guinea. Bats are the reservoir for this disease, and humans traditionally have gotten it either by consuming animals that had been in contact with bats or bats themselves, as was the case this time. But now the outbreak is spread differently, and it's completely human-to-human transmission. The outbreak is currently being spread by people coming in contact with the bodily fluids of other people who have symptoms of the disease. So people who care for their family members or relatives or community members and come in contact with the bedding or with surfaces that have been contaminated by the virus. The response of the international community to the epidemic, it has to be said, was quite late. And the number of cases that were allowed to occur prior to the world reacting in a way that it should have much earlier really has grown beyond our ability to control it easily. It's raging now out of control in the three countries of West Africa, Sierra Leone, Guinea, and Liberia, and all of the stops have to be pulled out to try to bring this outbreak back into check. We put it in a number of ways. First of all, the outbreak needs to be stopped. That's the first thing that needs to be done, and that can only be done, as I said, by making sure that patients are isolated and kept away from others, that people do not risk exposure by coming into contact with the body fluids or surfaces that the patients may have touched and therefore are now contaminated with virus. So in terms of the outbreak itself, isolation is the key. That means many, many more places need to be built where patients can be taken to be cared for and to be isolated from others. There aren't nearly enough beds right now for patients to occupy. There are some hospitals being built. Our system proposes to build up many smaller, closer to the community sites. That's number one. But we have to begin to consider now as well the consequences that the outbreak has had outside of the epidemic itself. All of the health facilities in all three of these countries are closed. That means if someone gets malaria, a life-threatening illness, if someone gets pneumonia, a life-threatening illness, there's nowhere to go. So we have to start standing up healthcare services in these three countries. Again, imagine countries that have no health services whatsoever to offer their population at this time, because many, many health workers died in the early stages of this outbreak. Not knowing that they were dealing with Ebola virus, they took care of their patients and they became infected and subsequently died. But this is not a disease that attacks children preferentially. The schools are closed. Children have no place to go. Many children are orphaned because their parents died. They're abandoned in the hospitals where their parents have been cared for and then subsequently died. They take to the streets. They have nowhere to turn. They're being shunned by their communities because they've been possibly in contact with their parents who have subsequently died. So it's really quite a nasty situation. And although children are not infected at any greater rate than the rest of the population, they will bear the consequences more heavily than others.